Hello again, Dr. Charlie Schuster. I'm going to be talking about mid-back mobility, thoracic spine mobility. Before I get into it, why that's so important. The mid-back has a major impact on the pelvic girdle and also the shoulders. And one of the first things we always talk about when we talk about mobility is, again, getting the right software uploaded before we start to work on the hardware. And we want to make sure there's no hiccups or viruses there that we're going to be training in. So we always say mobility before stability, and we're going to go over mid-back mobility. But one of the great things to do if you're going to be working with a shoulder, neck, or mid-back is to check your breathing. And I would just be remiss not to start with something as simple as breathing. And I could do a whole section on this, but I won't. Breathing is so important for our health, and yet in our society, I don't know if it's subliminal or how we get this virus exactly, but what ends up happening is that we want to, maybe we just don't want to appear pregnant when we shouldn't be, or maybe we're worried about that how we appear, but we want, seems like, to keep our pelvis in, and we tend to start breathing with the upper lung. So kind of catch yourself, or do this on somebody that you care about, and say, hey, take a deep breath, and see if they're breathing with the very inefficient upper 1/3 of their lung. Oxygen exchange in their body is just not what it could be. And so muscles are going to develop more lactic acid, they're going to be more sore, and you're not going to have the results in your rehab program. And so this breathing has to occur correctly. So one of my favorite things to do, if you just want to stand and check yourself, obviously you'll see if you're using your shoulders, but also to retrain yourself using some biofeedback, if you'll put your hand on your chest and then the other on your belly button and pretend you're going to take air in through a straw right to your belly button, then you can start to breathe correctly and start using your lower lung. And that's a great way to get your breathing back on track. A better way is called crocodile breathing. You have no choice but to learn how to breathe right here without even thinking. After a while, it just starts to happen because, again, like riding a bicycle, you know, your midbrain knows how to breathe correctly. We have receptors in the abdominal wall that we want to start to communicate with the apneustic center or the breathing center in the midbrain. So you cross our arms over, put the forehead on the arms, take a deep breath. And most folks that have real breathing issues, I'll see their upper body rise off of the ground for a little while, but not usually after about a minute. So about 3 to 4 minutes of this, just laying on your tummy, taking a deep breath into the belly button. At some point in there, we should start seeing that low back, and you should start feeling it raise up off of the ground. Once that is trained in, again, 3 to 4 minutes is usually very adequate. We now have good software for thoracic spine mobility. And then what we're going to do is we're going to grab a baseball. I really like a baseball. You could use a lacrosse ball, or you use a tennis ball if you're a beginner and you don't have much of a pain tolerance. But we're going to use the baseball underneath the mid-back. Now I'm going to put that guy down on the ground, and then I'm going to put it just under, off to the side of my spine. It should never be right on the spine. And I'm going to search for sore areas in my upper back as I roll over it. And maybe I don't feel quite sore there, but if I bring my hand, keep my thumb and hand straight up like this, and come back, right about here, I can feel a little bit of tightness. I know I can do better than that. I'm going to find another spot. There it is. I could do better than that, so I'm going to move it around, and then, oh, there's the home run right there. I've got a trigger point starting there, and I'm just going to go ahead and come back 10 times, keeping my arm as straight as I can, just like that. And as I do that, each time I'm untangling the muscles in my thoracic spine before I stretch it. You'll notice I don't do a lot of stretching on these videos. It's not that I don't think stretching is important, it's just that it's not very helpful if you don't have the right software and if your muscles are tangled, because you tend to just stretch areas around where that tangle is, and you'll just end up a little looser after the stretch, but then quickly going back, regressing to where you were before because of those tangles. So I call this flossing for the muscles. I didn't come up with that term. I'm not sure who did or who to give credit for. But I like the term muscle hygiene, I like the term muscle maintenance, and I also like flossing because they're all a great way to let us know that, hey, we need to be doing this just like we take care of our teeth. And if I come up a little bit more, I'm just going to work down by going up. So, as I roll up, the ball goes down, and I can find some other areas on my right side. This will take a few minutes. This could happen while you're, again, watching TV. It can happen while you're having a little conversation. It could just happen while you get peace and quiet. And so whatever works, but this is a great daily activity, especially for people who sit a lot or drive, and it's wonderful because it really makes it a lot easier for the massage therapist or chiropractor, physical therapist, whoever's working with you in the field of physical medicine. It makes it a lot easier for them to get their job done when you do need those checkups. And in our clinic, we always say we try to teach our patients to fish instead of give them fish, because the more they know about what they can do and the longer they can go between tune-ups or appointments, the better we've done our job. There are just too many people letting their physical health rule them. And you're seeing me go up and down like so. And I'm trying now, when you first do this on a sore area, you may only get your arm about this far, but you want to work on getting it all the way back without bending. See, that doesn't, you want to keep it straight. Now actually, I did just find a spot when I did that, so I'm going to go ahead and go a different angle. That's permissible. So it's a lot of just finding here those areas and loosening up that rotator cuff. And that's going to be so helpful for the shoulder too. It's hard to teach just one thing. I mean, this is helping everything. So it's even helping the lower back. So that's a great way to get the shoulder loosened up, but also prep that mid-back. I'm going to go ahead and just do the other side briefly. Find out if there's any spots there. Some of us who've never done this, it's going to be a lot harder. You may want to use a tennis ball so that you can just kind of relax and not have to sit there going, oh, So, but I urge you to get to pretty firm pressure with it. And I mean, if it's not uncomfortable, it's probably either not the right spot or maybe just not in need of it. But I can't imagine anybody not having cobwebs in this corner. I always use that analogy because any muscle that doesn't normally get good blood supply or isn't getting cleaned out, it's going to develop lactic acid overload. That's going to cause tangling of the muscles, so we got to untangle the muscles and increase circulation, which is exactly what this is aimed at doing. So I've moved down, now I'm coming back up, and I found a really good spot right there. I'm going to have to hang there for a few, 5, 6, and 7. So you see it's not comfortable, I'm not acting. 9, 8, I think, I'm cheating. 9, you tend to, move your numbers up when it doesn't feel as good. That's natural. So that's the preparatory work. Now, a great stretch I like to do. Many people need a towel to do this. It's not comfortable, but start by just going forward and stretching out this entire back line. This stretch alone is very diagnostic for me as a chiropractic physician, but for yourself especially, because if you do this exercise in the tightest spot in your body is your calves, that's an area we need to focus on. It's just telling you that that's not bilateral, it's not right. So you want to roll it, stretch it. We talk about that in the ankle mobility class, but I'm going to tuck just like this. I'm going to hold. Now, if you can't touch your toes, like I said, grab a towel. You should have a belt or a towel when you do any exercise if you know your flexibility is not there right now. That will change as you untangle these muscles. We see it happen in just a couple of visits when we do soft tissue work in the clinic. So it'll definitely change, and as we reprogram the software, and that's the exciting thing. So as you get down like this, you hold it for 15 seconds, Then I'm going to take, without doing anything different, just take my ear over. And I'm feeling that more on my left upper back now. It's a great stretch. And especially after you untangle the muscles. And I'm going to do it on my right side. Just take my right ear over and just drop my head. I feel that in just a very slightly different area on the opposite side when I do that. And but overall pretty balanced, and that's good. So feeling good about that. Now that I've done a nice stretch on both sides, we're going to start to wire in more motion. I like to do a lot of pre and post whenever I do something, and you can do this too. Yeah, things improve when you measure. So when I sit down and I hold something like could be an Intracell stick or any kind of a dowel. Those of you who don't have an Intracell stick, this is one of the best things to keep under your couch at home. Just sit there like this and rotate, and you can see how far your rotation is. If you're sitting when you're doing this and the trunk is planted, you get a real idea for how much movement you have in your thoracic spine. So you might see, and I'll just play this off, it might be easier to see with this. Let's say I can only go this far to the left, but this far to the right. Well, that's a pretty big discrepancy there, and that is, I mean, that's a dysfunctional movement pattern, most likely. And so we want to train that out. And so, excuse me, it's fall here in Charleston. All right, so what we're going to do is get down on our hands and knees, like so. And I'm going to have you put your hand on the back of your neck, look straight ahead. Now, you should not feel any cramping when you do this. You've gone too far and pushed yourself too hard. It's not going to be any good. I want you to go as far as you can comfortably. And at first when you do this, don't push it too much. But the important motion here is a nice fluid. And you want to, this is the hardest part for most people, just touching their elbow to their opposite knee. They get right here. Because their lower core and cross-crawl function of that core is just not there. So you want to come up as far as you can, down as far as you can. There we go. And you'll see as I come up, I almost get a little too fast and cheat. You don't want to do that. You want to go nice and slow. I'm going to do 10 of these. I can feel that when I open up. I can feel that in my left hip, which is awesome. Always pay attention to other things as we're doing these. You'll learn a lot about yourself and your body. It's a wonderful machine worth knowing about. Rotate, come down, good. We're going to do that 10 times on the right side. Now I'm going to do it on the left. Okay? Up, back, up, back. And these are some pretty simple exercises. Go as far as you can. If you can't touch your knee because of certain reasons, you know, go as far as you can and then back up. It's okay. Do what you can. Remember, your brain thinks you're going 10 degrees further. That's pretty cool, isn't it? It's a principle we learn in rehab so that you don't exercise into a painful range of motion ever. That's not right. And you do that 10 times on both sides. That concludes thoracic spine mobility.